Hey folks, John from Bike Fit Advisor. So lately I've been getting even more questions through the website, on the YouTube channel. And so I thought I'd take the time to do another Q&A. That went over actually reasonably well, so I thought I'd do another one. And some really good questions have been coming in, some repeats, so I wanted to address them here. The first one came from a subscriber, and I'll just paraphrase. Basically, he's having knee pain. He calls himself reasonably tight or restricted as far as his flexibility goes. And he's wondering if he should just go ahead and get shorter cranks on his bike now to help with his knee pain. And if you haven't seen my video on knee pain on the bike, I will link it in the description below, and I'll put a card up here as well. And to answer this question, the crank, shortening the crank might help. It has actually a pretty reasonable chance if you can shorten it enough. But there's some simpler and potentially some much cheaper ways to go about this. I think if I were this client, I investigated a little bit further in going back and forth, and he mentioned that his reach on his bike is he calls kind of moderately aggressive actually. And so I recommended first that he plays with the reach to the handlebars. The reason being is that our reach could affect even something as simple as, or seemingly far away as knee pain. And the way it does is if our reach is, if the handlebar position is not perfect for us, it's not particularly set up well for our mechanics, then what it can do is, if it's just a little bit too long or a little bit too low, or sometimes if it's even too short or too upright, what will end up happening is it will cause a chain reaction to occur through the shoulders, because we are, in the instance of it being too long, let's say, we are reaching a little bit further than our shoulders and our spine and our pelvis can comfortably do for long periods. And so it can pull the pelvis out of position on the seat. And when that happens, we end up with either one of two things happening, and sometimes both. Either the pelvis is in a posture that's twisted on the seat and it's not sitting evenly, which can then lead to sort of unequal movement between the knees and then cause some problems. One knee then is straightening more than the other, and one knee is moving away from the bike, etc. Or even if it's not pulling us in a static way, in a consistent way, off the seat, it can definitely affect our mechanics when we flex forward further than we're able to necessarily. It's going to cause some restrictions in a lot of people in how free of movement they have into hip flexion, which will then cause some deviations of the knee again, but it also can inhibit the hip extensors, the glute or the butt muscles, which can affect our pedal stroke and on and on. So that's the first place I would look, would maybe modify with just some tiny changes to the handlebar position. And the other thing, and this is much kind of more overt, and it's not necessarily simple, but there's a lot of things that can be done about this, is I would investigate just working on mobility. Keep working on some mobility and flexibility exercises. There's a lot available online. You can go and look. I do have a program available. I'll also link it down below. That is a paid program, but it's a complete mobility program for cyclists, specifically for cyclists. And there's a lot of gains that can be made, and you don't need to make huge gains to make progress in this area. So a little bit kind of goes a long way. And both of these things are going to be much more cost effective than potentially replacing a crankset, which you're looking at anywhere from $200 to $500. So next question. This one has come up a couple of times. This is a great question. Not something I anticipated, but should have. And it is, how do I tell on the bike if my hips are rocking? If, and this might be significant if, let's say, in the instance where the saddle is too high. This is a great question. There's a couple things you can do about it. It's pretty simple. Most people have access to a camera, or if you have a riding buddy, that can be helpful. But to make the hip motion more apparent, what I would recommend is to take something simple like some tape that's a contrasting color to your riding shorts. And you can either use little dots of this contrasting tape, and you can put one dot on each of the what's called the PSIS, which is the posterior superior iliac spine. They're essentially, if you look on the low back just above the rear end, they're the kind of the dimples back there. There's two bony prominences back there. And those are sort of a decent landmark for the pelvis. It'll tell you a lot what's going on. You can even do it simpler than that by just taking a length of tape, and take that length of tape and run it parallel to your belt line. Okay, so it's going to be running horizontal, again, on the back of the shorts, but just below the belt line. Kind of stay like as if you're wearing a belt really low on the back of your hips. And just run on maybe a 6 or 7 inch length. And then when you get on the bike and ride, and either if you're having a friend view or videotaping is probably the best thing, and we all have access to, through phones and GoPros and digital cameras, you can just set up a tripod even and videotape yourself. But the tape will make the movement much more prominent. And what are we looking for? We're looking for two things. One, and sometimes most importantly is, and easiest to figure out is the motion to each side even? And the tape really helps with this, because often you'll see, if we mark those PSIS there, you'll see one side and it seems to be everything is going towards one direction. So that's the first thing. We want even on. Let's say it's even on both sides. Then how do we tell if it's too much amplitude? And this is a tough one. It's generally the amount of motion that occurs between those PSIs. Yeah, it's depending on your size, it might be between an inch or two of vertical motion. The way I prefer to kind of look at this is when you're looking at those PSIs and you're watching them go up and down, or that horizontal piece of tape go up, side to side like that, is to look up the chain. And if you do so, you'll see the thoracic spine, or the lumbar spine into the thoracic spine moving. And what we're kind of looking for is if both sides are moving too much, or one side is moving too much, what you'll invariably have to see is that spine will have a compensating or compensatory movement to the opposite side. So if the left PSIS is dropping and moving a lot in amplitude up and down, when it goes down, the right side of the thoracic spine is going to move to the right. And then on the opposite side, when it goes to the PSIS goes to the right, then you're going to move to the left. And so you end up with the spine moving in this sort of fishtail sort of fashion. And that's more telling if they can't keep their upper body quiet as they're pedaling. That's kind of a better indicator sometimes of having too much movement. If sometimes you can just look at the amount of hip movement and you can see it's just too much. But another way would be to do some video capture from the side, a lateral view. And I have a couple of tutorials that are free for members on my website. You can sign up for that below. It's just a free membership. And in the member section, it walks you through how to do a video bike fit. And basically what we'd be looking at is what is the combination when we're looking at what is your knee extension, like at the top and the bottom of the pedal stroke. And then also, what is the ankle doing? Because then that can tell you, okay, is my saddle too high? Because my knee is just about, it's okay. It's maybe on the long end as far as it's straightening just, to the very end of what's considered normal. But the ankle is really having to compensate and toe down to reach the pedal, that sort of thing. So, all those are ways that you can look at, how much the hips are moving. But again, just being able to see from the back and marking some landmarks on the pelvis goes a long way. The next question was about was dropper seat posts and the saddles that kind of go along with them. And the problem this cyclist was running into is that because dropper seat posts have basically a minimum height to them, they can insert into the seat tube of the frame to a certain point, and then they can't anymore because there's usually a collar and then a telescoping slider that gives you your ability to raise and lower the seat post. And this is something that I see pretty frequently on smaller bikes, especially the larger the wheels get. So say the 27.5 or 650B. Those frames, especially now with some of the B plus frames with the wider tires, or the 29ers in the smaller sizes, because we're talking about this is a bike for a smaller person, potentially, or most likely, a fairly short inseam on the rider. And now we've got these wheels that are taller, either because they are just nominally taller because they're a 29er or something, but also taller because the plus wheels have a greater height to them as well. And then with the longer travel too, when you're dealing with 5, 6, 7 inches of travel, invariably you have to have a seat tube of a given length, just because you're trying to fit all this stuff into the main triangle with the suspension. And so, even on some of the seat posts, the dropper seat posts, they have different lengths, and even some of the shortest ones for some people are not short enough, or perhaps it was ordered incorrectly, whatever. And so you do have to be very careful with that. I have run into a few situations with big bikes where someone was struggling to get the seat high enough, and that's obviously the opposite problem, but still the fairly big deal if you're out riding for significant periods and you can't get your saddle height high enough. Now, yes, sure, the shorter rider could always lower, if they can't get their seat low enough, they could always just lower the dropper a little bit and let it settle to where their seat height is. But it's a bit fiddly to have to do that every time you activate the dropper and raise it up and down, and also finding that right height. It's always nice if your top portion, your highest seat height on those is kind of your perfect cross-country style riding seat height. But it begs the question, let's say you're in this situation and you absolutely are trying to get the right seat height. The next place to look really is, short of changing your frame, is low profile saddles, and there's a lot of them out on the market. But basically the idea that saddles have different stack heights. You have between the top of the saddle and the rails that measure that distance, and there's a number of them out there. I will so the ones, and this is what I responded back to this rider, and I just went off the top of my head with some of the saddles I'm familiar with, but a lot of the road saddles tend to be lower profile, especially like the Sella Italia, the SLR is a very low profile series saddle. I've been riding lately, and it's worked well on both bikes, mountain and road, is what is it called? The Tioga Spider, and it's this sort of funny looking plastic web looking thing. Very comfortable saddle and pretty low profile, not much stack height to that saddle either. But there's plenty of options between, so there's some Pro Logo saddles that are short, and Ergon saddles that have pretty reasonably low stack heights. But the main thing about this is you really can just go around looking at saddles and taking some measurements. So. The last question I got, and this is a really good one, I got a question about how long people should go in between bike fit checks. And that's a really good question. I think a lot of times people think of bike fitting as this one-time thing. And, especially if you spend a few $100s on it, yes, you probably are not eager to go back, every, couple of months or every year even to check on this. But first of all, many bike fitters, and I think some of the best bike fitters often offer checkups for free. I know I do that at my studio here. For 6 months, people can come back and get things checked out, and that's important when you're doing follow-ups. And most people, actually, pretty much everybody I've had has never really, abused this in any way. But it's worked out really well because I do a checkup with them. It takes 20, 30 minutes. And they get, this tiny little problem kind of tweaked and solved, and I just get more information. So that's great, but I'm digressing. So, you should really have a bike fit check anytime you have something major change. Let's say you've gotten over a huge injury, or you've been off the bike for 6 months. If you had a surgery, whether it's orthopedic surgery, you had a shoulder reconstruction, or something like, if you had a knee replacement or a hip replacement, or you just even had an arthroscopic surgery and are just struggling to, kind of work back into shape, and something's not feeling right on your bike, those are usually really good indicators that you need to kind of get things checked out again. Even I've had many clients come back in after general surgery, meaning like abdominal surgery, appendix out, or something like that. There's a lot of things that can happen from an abdominal surgery to really throw off sort of the balance on the bike, not least of which is, our core and our trunk control on the bike. So, So major changes, surgeries, that sort of thing, lots, extended periods of time off the bike. But in general, under normal circumstances, this might sound like too frequent for people, but I usually tell them like every couple of years, every 2 to 3 years, if, even, especially if you can work out an arrangement with your bike fitter that you've gone to, where you kind of can just get every couple of years, go back in, maybe for a slightly reduced cost or something, and get a checkup done. And the reason I say this is because I've had people do this fairly frequently, and they've actually come back in and they said, hey, I think I felt fine. I think I felt pretty good. And I would say 100% of the time, we've kind of found some little thing, or maybe a couple of little things that we've kind of, tweaked, and not any major changes, but we did these tiny changes to, say there's, a small change to their saddle height or fore aft, or their bar position. They were able to get a little more aggressive or something like that. And I would say without exception with those clients, they have all kind of remarked that, gosh, I am really glad I came back in. I didn't think that anything was really that bad, but I and after riding with this, with these changes for a few weeks, they just they can't stop talking about how much different they feel. They hadn't, basically the moral is the gist of it is that they didn't realize how far they had, how far off they were, how far away they were from sort of their optimal level of positioning and comfort. And riding bikes is kind of like that. We spend so much time on them. It's this slow creep of symptoms that sometimes we just sort of block out to some degree, and we forget. And that kind of brings me back to my original point, is that these, we think of these bike fits as one-time things, but yes, we can change the bike and you can be doing really well and do well for a long time even. However, no bike fit is static. We are always going to be changing, for better or for worse. And so often people, I would say without exception, you get a bike fit and things are good, you need to stay on top of that, because it's going to continually change as you go through. And sometimes you're not even aware of all the changes that have happened. And that's why when I finish my bike fits, I am trying to plan in some changes for this person for the next, months to even years, where we'll talk about their predispositions on the bike and say, okay, yeah, we raised your saddle a little bit, and you actually adapted in the last few weeks really well to that. And so what we might be looking at is, once you've got another 6 months of riding under your belt and you really are stretching to the bike and really adjusting and adapting to it really well, we may be in a situation where you can raise that saddle again, or maybe that's even next year we can do that. So I try and build in some planning so that their bike fit isn't obsolete in 4 months or something like that. So I hope that answers some more people's questions out there. I know I got a lot of these were, the reason I brought them up is they were, I got them multiple times from people, so that's why I wanted to address them. If you do have your own questions or anything you'd like to bring up, put them you can put your comments, your questions in the comments below, and I'm always happy to answer those. And frankly, you can ask a lot of my subscribers that, if I get, if it's appropriate enough, or if it's, often I will just make videos about them. So that's it for now. You can see more at bikefitadvisor.com, and otherwise we'll catch you next time. Thanks.